Sickle cell anemia, deadly and not to be taken lightly.
Sickle cell almost killed me.
I've been living with sickle cell for 34 years.
I wish I should not be a sickle cell again.
Because there are times when you feel as if the whole world is crashing in on you.
Sickle cell disease is a global health problem. Nigeria is the greatest burden carrier with about 150,000 born and 100,000 deaths annually.
This is troubling for Nigeria because Nigeria carries the highest burden worldwide, and over 4 million people already have this disease in the blown out form, but over 40 million again carry the trait. So with continuous marriage of these people, we'll find out that more will be born. So a step has to be taken.
So sickle cell disease is a genetic disorder. That means it is inherited. When two parents with the trait, means they have heirs, get married to one another, they may give birth to a child who has sickle cell.
It takes about 2 days because the pain is very painful and I feel it in my bone very well.
Tó bá ti bẹ̀rẹ̀ báyìí, àpẹẹrẹ tí mo kọ́kọ́ máa rí ni pé tán bá ti kọ́kọ́ gbé oúnjẹ fún, tó bá ti jẹ díẹ̀, tó bá ti ní òun ò jẹ mọ́, ó ti bẹ̀rẹ̀ ni. So ó lè sọ pé apá ń ro, ẹsẹ̀ ń ro, ẹ̀yìn ń ro tàbí inú ń ro òun. Ìgbà míì ojú ẹ̀ lè yellow.
Severity of sickle cell disease varies. There are cases which are quite mild, in which they may have crisis just like once or twice a year, all right? And there are cases which are quite severe.
The last Anthony's crisis, that was last year, June. He was admitted in this hospital, Oni and Son. So they just admitted, by the third day, you get to coma. So the crisis was so much. Ó pọ̀ gan débi pé wọ́n dá dúró. Abẹ́rẹ́ tó kàn gbà is 1,000, but immediately tó wọ kúrẹ́ tó coma wọ́n change sí Rocephin 7,000 per day. It's 3,000, but tó máa gba méjì lójúmọ́. So they gbà fún wọ́n ní a máa gbà fún good 14 days.
In Nigeria, the economic situation and not so easy availability of health care or high malaria environment, coupled with a lack of a defined and specific commitment from the government, may contribute to worsening the problem.
Almost every family carries this trait. And when they carry the trait and there is no concerted effort to check their genotype before getting married, people continue to have more.
Akonwo Daniel shares his ordeal with living with sickle cell for the past 40 years.
For instance, there was a time I had crisis. My parents had gone to their place of work. I went to school strong, ill and hearty, only to be brought back home. So I just had to put up with pain, excruciating pain. I can't describe it. I felt as if I would die that day.
I just started from chest pain. I thought it was an ordinary pain. All through the night I was unable to sleep. I was rolling, crying. I said all the prayers I knew in this whole world. Early morning, my mom rushed me here to UCH. Then I met a doctor and instantly I was on admission.
Sickle Cell Hope Alive Foundation, SCAF, is a non-governmental, non-profit charitable organization. Her vision and mission are to enhance awareness.
It has made tremendous contribution to awareness creation on sickle cell disease in Nigeria, providing palliative measures for those people suffering from the disease, capacity building, research and training, advocacy, policy dialogue, and networking with sister NGOs both in Nigeria and abroad.
Journey began much earlier in my heart because of the antecedent of the excellent research of over 40 years of genetics on sickle cell disease. Our objectives will be to empower those who already have the disease, assist them with drugs. They use routine drugs they cannot afford most times.
This is the Biorad HPLC variant 2 system.
which we use now for our hemoglobin type determination, it is highly precise and specific. It determines the type of hemoglobin for sickle cell, for the diagnosis of sickle cell, and for thalassemia. This equipment is is very expensive, but Schaf is collaborating with the unit in subsidizing the cost of testing so that people can benefit.
We are proud of the fact that we have been able to bring those highfalutin, impressive research of over 40 years into use in the community. That we are not just leaving these patients to grope about. People do not give them jobs. They say, oh, he's going to die tomorrow or something, which is wrong.
I was empowered and enrolled at University of Ibadan 2015 for the empowerment skill, where I learned so many skills which I'll be using to help myself today.
So that they can be on their own, be able to supply their own financial requirements and be able to produce some things by themselves.
In the past 5 years, Schaf has been involved in a prevention approach of sickle cell disease through two main frameworks, awareness and care. The foundation is equipped with a multidisciplinary team of researchers, medical and community-oriented professionals, all working together to assist in facilitating improved care of those affected with the sickle cell disease.
The whole university was closed down to listen to my lecture on sickle cell disease. And one of them stood up and said, why are you not in Maiduguri? The thing is more in the north. How many places can Schaf go to?
The Know Your Genotype KYG clubs is set up to uniquely help establish even much wider awareness of the sickle cell disease.
So if a club starts in a school, over the years, over the months, they will make more members. We start with an initial 6 members, and then the school principal and the science teacher is part of this, and they make this grow in the school.
Professor Olaiwola Babatunde Shitu, a professor of surgery, College of Medicine, University of Ibadan, highlighted an interesting aspect sickle cell patients may suffer.
Priapism as a disease is actually an abnormally long, or what we can call a prolonged erection of the penis, and could last sometimes up to 4 hours or more, thereby resulting in significant pain and subsequently can cause a damage. Priapism in sickle cell patients tends to be more common in the fairly early ages, sometimes within the first, second year, up to about 10 years. And then, of course, there can be priapism that present later in some people when they are in their 20s and beyond.
Good morning. How are you?
I'm fine.
Oh, come inside.
Leg ulcer is another common aspect of the sickle cell disease suffered by its victims, and Dr. Ayodele Ogunkayede shares more light on this.
It has been an awesome experience working with Schaf. They have provided a lot of finance in the area of care of leg ulcers in these sickle cell disease patients. However, by second decade of life, the chronicity of the sickle cell disease starts to have impact on the skin, and this leads to what we call skin breakdown. And when this skin breakdown occurs between the knee and the foot, we call it leg ulcer. And because of the primary problem, which is sickle cell disease, there are repeated and recurrent sickling of the cells, which worsen the situation of the wound, and this makes the wound chronic.
Questions remain about the possible cure of this dreaded disease.
There is a cure for sickle cell disease. It is called stem cell transplants. In this process, the stem cells are certain kinds of cells from the bone marrow that give rise to the normal blood cells. So these cells are obtained from a particular individual who doesn't have sickle cell disease and are transferred into somebody with sickle cell disease.
Schaf has instilled some discipline apart from knowledge into my psyche. I have learned to manage this crisis better than I used to.
In the government, if they can assist the Schaf to be helping us, because one try for If not because of them, maybe I would have lost the child.
Àwọn tó rí jà, àwọn philanthropists, àwọn tó rí jà jẹ àtàwọn bí ìjọba kún wọn ràn wá lọ́wọ́, kán bá kún ọmọ yìí náà lọ́wọ́. Tí wọ́n bá kún ọmọ yìí lọ́wọ́ ń sìn, gbogbo eré ogun tí wọ́n ń sá a lè jọ. Torí pé kí ni eré táwọn ń sá ni pé kí sickle cell yìí kó dínkù ní Nàìjíríà.
Gidigidi lọ́wọ́ àwọn ìjọ Schaf pàápàá lọ́wọ́ mọ̀mọ́ wa Fálùsì. Wọ́n ṣe gudugudu méje yàyà mẹ́fà torí wọ́n ń fún wa ní oògùn, wọ́n ń fún wa kódà tá a bá tún lọ sí meeting, wọ́n tún máa ń fún wa ní owó mọ́tò.
One thing that I'm hoping we will start soon is that we will add newborn screening in this part of Nigeria to our work. That way, the frequency will be known fast as children are born, and parents can have adequate care of their children. Secondly, we will empower NYSC in Nigeria to take our message of reduction of sickle cell disease to every nook and corner of Nigeria in the different languages wherever they are posted.
If we have well-meaning Nigerians who can support this organization, they are walking their talk and they are reaching out to these children and their parents.
And therefore, it is foundations such as this that need to be adequately supported in order for them to get them across to care.
The integrity of Schaf is not in doubt. Everything that we do is very well documented. It's an NGO that is periodically audited. The members of the board and management are men and women of integrity, and we are very, very confident that we shall not be found wanting in any way or form.
You and I can join hands with Schaf to reduce the threats of more increase and to help persons already affected with sickle cell disorder age gracefully and achieve their dreams.
Please help fight sickle cell disease.
Let us make it a collective responsibility to fight sickle cell disease.
Visit www.schafng.org or follow us on our various social media platforms. Sickle Cell Hope Alive Foundation, Schaf, improving the quality of care and support for sickle cell patients.